Diabetics are dying because they can't afford life-saving insulin.
Some patients say sharp increases in the prices of insulin products are causing many to consider the risky option of rationing their insulin. Duane Pohlman investigates this cost of living.
This is what democracy looks like! Hey, hey!
In Indianapolis,
Price gouging has got to go!
Diabetics, including a busload from the tri-state, converge on pharmaceutical giant Eli Lilly.
Medicines for people, not for profit!
Protesting sharp increases in insulin prices, including Lilly's popular Humalog, a fast-acting insulin taken before meals.
When do we want it?
Now!
Spikes in the price of Humalog and other insulin products made by Lilly and two other pharmaceutical companies, diabetics say, are forcing them to face deadly choices.
Go! Hey, hey! Ho, ho! Price gouging has got to go! Hey,
According to the American Diabetes Association, the average list price of all insulin has skyrocketed in recent years, nearly tripling between 2002 and 2013. Adding, the reasons for this increase are not entirely clear. We asked for an on-camera interview with the company, but in a written statement, the senior director of corporate communications kindly declined, stating Lilly's last price increase for insulin was May of 2017, which she says has been Lilly's one price increase over the last 26 months. That May 2017 increase for Humalog was 7.8%, but that was on top of a 7.51% increase in 2016, and a hike of 16.98% in 2015, and 20.81% in 2014. According to the Union of Concerned Scientists, the price of Humalog has increased by 1,157% in 20 years, from 1996 to 2017. Lilly has offered as much as 40% discounts to patients who are having trouble paying, but has yet to answer our direct questions about why its insulin prices increased so much.
What killed your son?
Official cause of death was diabetic ketoacidosis. Unofficially, he died from corporate greed.
Nicole Smith Holt came from Minnesota to protest. Her son Alec died in 2017, just months after he turned 26.
He was no longer eligible for my health insurance.
Even though he was working, Alec could not afford the continuing cost of paying for life-saving insulin, including Humalog.
Well, he didn't have enough money in the bank to cover the $1,000 plus additional $300 for his supplies. He started rationing his insulin. He was found dead 3 days before his payday.
All right.
A mother still grieves over losing her daughter, Antavia Lee Worsham.
I miss her.
Antavia was just 22 years old. She had two jobs, including working at the concession at Bengals games. It was not enough to pay the bills, and a high deductible meant Antavia had to pay thousands out of pocket for her insulin, including Humalog, before her insurance would begin to pay.
Roughly between $1,200 to $1,300 for, again, a 90-day supply.
$1,200 to $1,300.
$1,200 to $1,300. She couldn't afford her insulin. She rationed. When my son found her in her bed, she had a pen in her bed, but it was empty.
In its statement, Eli Lilly addressed that issue, saying, unfortunately, some people are provided high-deductible insurance plans, which require people to pay thousands of dollars before coverage begins. The official cause on Antavia's death certificate, the same as the cause of Alec's death, diabetic ketoacidosis, a buildup of acid in the blood that can be, and often is, fatal when a diabetic doesn't get enough insulin.
She died as much from poverty
Yes.
as anything else.
Yes.
Antavia's mom is now on a mission to change that for other diabetics, including her other daughter.
Because I'm also a type 1 diabetic.
And the cost of living on insulin is just as steep as it was for her sister.
Without it, what does it mean for you?
If I go without it, then I'm not here.
Alec's mom is on a mission too, From testifying in Washington,
And Alec is not the only one who has paid the ultimate price.
Price gouging has got to go!
to protesting in Indianapolis. She has one clear message for anyone who will listen.
Stop the greed. Start putting patients' lives over your profit.
Price gouging has got to go!
Okay, go.
In response to increasing pressure over the price hikes, Eli Lilly opened a toll-free hotline in August to help patients find savings at the pharmacy. Lilly also began donating insulin to free clinics, but diabetics say it's not enough. They say Lilly and the other pharmaceutical companies simply need to lower their prices of insulin. By the way, you can find that toll-free number, Lilly's full response, and lots of other resources for diabetics on our website, local12.com. We hope it helps you or your loved ones avoid rationing your insulin and paying the highest price for this new cost of living. I'm Duane Pohlman, Local 12 News.